The reason why these cancers are referred to as turbo cancer is because they behave differently than cancers I've seen in my career. And I've spent close to 20 years either diagnosing cancer patients or treating cancer patients. And these are different. These cancers have a different pathophysiology. They are extremely aggressive. They often present at a very late stage, usually at stage 3 or stage 4. They grow very, very rapidly. Sometimes you see these very large tumor sizes, very, very large tumor sizes. They metastasize extremely aggressively to other organs. So when surgeons try to go in and remove these tumors, they find out the tumor has already spread. It's too late. It's already gone to other organs. And one of the key features of these cancers is that they are resistant to conventional treatments. They are resistant to chemotherapy, they're resistant to radiation therapy, and they're resistant to most immunotherapies as well.
Are you going to get into trouble if I ask you what should people with these cancers do? Because if you are, you don't have to answer, but...
Well, I can tell you.
Or is there some place people could be directed to get advice?
So again, you want to have a relationship with your oncologist. You want to get all the information you can on conventional treatments, but sometimes these treatments don't work. And so there is a new area of research called repurposed drugs, where we are discovering that drugs like ivermectin, like hydroxychloroquine, like mebendazole, drugs that were used for other purposes, like antiparasitics, for example, have really a tremendous impact on cancer and can actually treat some of these extremely aggressive cancers. This is a whole new area of research that I've been exploring in the past 2 years. It is very promising. And so, patients, I encourage cancer patients to look beyond what conventional oncology has to offer, because I'll be honest with you, in many cases, the oncologist will run through all the chemotherapy, all the different lines of chemotherapy, immunotherapy, and when they have no more chemotherapy to offer you, they send you home to die. And it doesn't matter how young you are. There's young adults in their 20s. I have teenagers are being sent home to die because the oncologists, beyond what has been approved for them, usually by big pharmaceutical companies, they have nothing left to offer their patients. And so, I encourage patients to look into this new field of repurposed drugs. Give yourself a chance to have a response, because I've seen this. Some of these tumors do respond to repurposed drugs.